I think that, I'm still under the notion, because oftentimes I will wear a shoe that may not be the most, you know, in the literature, the best shoe. It's sometimes what's comfortable, but I think depending on, the problem that's happening, like a barefoot shoe, I think if you get used to it very slowly, I think they're okay. But most people will go into thinking, oh, I need a barefoot shoe and start running. And they'll get tendinitis and they'll get bursitis of a joint, things like that, because their foot is not really accustomed to it. So anything you get, I think you should really ease into it. Even with a custom orthotic, I tell people take 6 weeks potentially before you even start running in it, just because your foot has to accommodate to that device. So naturally, I like stiffer soled shoes. The foot being 28 bones, 33 tendons, and 100 ligaments, there's a lot of motion there. And if you have, and everyone does have some subtle difference in the joint spacing and the way the tendons work, if the foot can move as a whole unit, it tends to takes a lot of stress off the individual parts. So if you have big toe joint pain or the outside of your ankle hurts, if you have a more solid platform, it allows the foot to kind of move more uniformly. So not necessarily thick, but the stiffer the sole, I really do like. Um, as far as style and brand, I don't think it matters to me as much. You got Hoka's, Brooks, Asics. I think if you were to do apples to apples, I think a custom orthotic with a generic shoe turns out to be better than, the most high end shoe. So a lot of it too is cost. Some of these new shoes are $200, and you could spend a couple $100 on an orthotic and get a $50 shoe, and it's better than the $200 shoe. And generally, with custom orthotics, they'll last you, 5 to 25 years. So I don't think everyone needs a custom orthotic, but I think you have to kind of know and get an evaluation on some level to what type of foot you have, what kind of things you may be predisposed to getting. Flexible joints, as you know in your practice, if you have a really flexible joint, you're more predisposed to getting ligament injury and tendon problems, versus someone with a lot of arthritis. I think a rocker bottom type shoe is really good because it kind of helps propel you. So a lot of it really boils down to the predisposition your foot has to having problems. It's kind of a 2 or 3 step approach. I mean, obviously, arthritis itself, knee is a little different because it's a hinge joint. So if you really have limited motion from that arthritis, it's going to be pretty hard to flex and extend no matter what. But like in the foot, you can move as a unit. So generally, arthritis has no reason to have to stop running. You just have to accommodate that arthritis, maybe with a little bit of stiffness, maybe with certain kind of insert modifications. So structurally in the foot especially, arthritis does not keep you from running, but you do have to protect that. Once you get arthritis, there isn't reversing it conservatively. I mean, there are research that's driven to, and you and I both, we love like Regenex and stuff like that. But like even in the medical research, there's not any easy way to regenerate that cartilage. So you're just really trying to protect those joints from getting flare-ups. Now, if you get flare-ups and stuff, that's where all that other type regenerative medicine and modalities, y'all do amazing modalities between newbie and things like that really get over the inflammation. Those are more the acute flare-ups of arthritis, as well as supporting, like when I look at arthritis, and if say it's a big toe joint, you really want to work on the tendons that can support that joint to help kind of offload that joint. I mean, I see a ton of people with big toe joint arthritis, and you would think, how in the world can you run if your big toe joint doesn't bend that well? But again, you can do slight rocker bottom. You can do a Morton's extension in an orthotic. You can help work on some of the other muscles. Like I think if PT does a really good job of strengthening the peroneals, kind of helping with that flexor hallucis longus tendon, then that allows the foot to kind of forefoot pronate without having to put a ton of stress on that big toe joint. So there are a lot of things that can be done to keep someone with arthritis running. And I would also say it's probably something that I don't need to see as often as I do. if I'm seeing it initially in the clinic, I'm going to make sure they didn't have a, heel bone injury, something like that. But those kind of differential diagnosis, like a pinched nerve or a heel bone, they tend to have different symptoms. It's more like burning, tingling at night if it's a nerve problem, or the morning is not so bad, but then as you walk more, the heel starts to hurt a lot worse. That could be a little heel stress fracture. But in most cases, that morning pain after running pain is plantar fasciitis with that ligament running on the bottom of the foot. And generally it's the mechanics, the stress on the foot between your foot type and a tight calf muscle tends to inflame that tissue. Generally, if someone gets it kind of quickly, that's the easiest way to get over plantar fasciitis if someone has diagnosed it early. So if you start noticing that, really stretching the calf muscles out, frozen water bottle rolled on the bottom of the heel, good stiffer soled shoes, limiting bare feet, even sometimes whatever method of anti-inflammatory, if someone does an ibuprofen or more holistic with turmeric and arnica, things like that, that can help get rid of the inflammation. But being a little more aggressive with that stretch and that good support, the difference kind of in chronic and acute plantar fasciitis, it does have an interval of time. So if you've had that heel pain in the morning for months and months and months, generally to get over that is a lot harder because the heel underneath has pretty bad blood flow. So as that scar tissue begins to kind of gradually develop, it's no longer that kind of puffy inflammation. It's more scar tissue. And